Hello, my name's Jack. I'm here with Rachel Taylor, who is a SHPA Fellow. She's presenting a poster here at Medicines Management 2015. Rachel, tell us about your offering.
Thank you, Jack. I've co-written a paper with two colleagues. We're based at Epic Pharmacy in Port Macquarie, Port Macquarie is a small country town. It's got a population intake of about 70,000. And the inspiration for our poster is that we have a very small population of patients who have cystic fibrosis who come through the area, and it takes us 4 or 5 days to get the results of the therapeutic drug monitoring back for the tobramycin, only for these 4 or 5 patients who come in. But the antibiotic guidelines say that those should be received within 24 hours and actioned upon. So basically we're working off the acceptable guidelines. So we thought, what do other sites do? And then we got some data. We put together a survey, got some data from other hospitals who are outside the metropolitan area in New South Wales. 22 sites responded for us, and the results are on our poster, which is number 220, if people would like to come and see it.
220. So start at the back and work forwards, I reckon.
That's always the best way to go.
So you've had some implementation and you're seeking to implement it elsewhere?
So there's not a lot we can do about it because it's a TDM issue. So it's really pathology doing it. Now, because there's only 4 patients, they come in episodically. Mm-hmm. And the test, whilst it's a simple test to set up, the pathology units could do it with no problem, but it needs to be validated every year. And so the validation of the test is therefore expensive. So there are some things that sites can do. So they can ask the pathology departments to do implement the test at their site. Or perhaps we could think outside the square a bit and improve the way that things are transported to external hospitals. If, for example, some of the tests are done 500 kilometres away from the base hospital. Right. That if it has to be shipped to a big centre to be tested, then it takes a while. Maybe we could expedite the shipping. Australia Post manage, why can't we do it with pathology samples?
Fair enough. Yep. Well, yeah, eBay seems to manage, so
it does.
Why
Gets
not?
Things there overnight, so...
Yep.
The other thing that really does come in our research is the fact that New South Wales, which is a moderately sized state in comparison to, for example, Western Australia, is really, really big. So one of our sites is the equivalent distance of London to Barcelona. Wow. So if you look at the distance, that's the distance we're talking about from them to the hospital who does their monitoring.
So this problem that you've clearly highlighted, who are you trying to get to change
who are trying
their
to
practices?
Get to change? I think it's maybe it's looking at things that most of the patients with cystic fibrosis would be in a big metropolitan area. In New South Wales, it would be Sydney, Wollongong, Newcastle. They think 70 to 80% of the patients will be centred in those areas, but then we've got 20% who live somewhere else. So do they have to go to big centres to get their treatment? Or can we treat them at home where they actually live? So I think it's a greater responsibility of perhaps all of us to be aware that rural centres, we still practice the same way. We're not in the Stone Age, and we'd like to be able to do the same things that our city colleagues can do for our patients.
And fair enough. Yep. Are there any other co-contributors on the poster?
I've got several. So our intern actually helped us with the research. She couldn't be here this weekend, but Chris Giles, who's the pharmacy practice group for Epic Pharmacy, which is for whom I work. He's been a contributor on the paper, and Heidi Fellon, who's the dispensary manager at Port Macquarie Base Hospital with me, has been another co-contributor.
Terrific. And anything that you're looking forward to seeing over the next couple of days?
I'm looking forward to seeing all the posters that are out there. Like you said, start at the back numbers and work way through. So that will be great to see the contributed papers and posters. And we've just had a fabulous presentation on the profession. Really, we need to help ourselves be better regarded and work our way through.
Very popular.
Yes, getting hospital pharmacy better regarded in the Australian network of health, I think.
Well, get-togethers like this is about making that happen.
It is.
Thanks for talking with us today.
Thank you, Jane.
Thank you.
Thank you.